Well, we're very fortunate to have a great leader in Governor Haslam, who has tried to find a way to help the 300,000 to 400,000 uninsured citizens in our state get coverage. And many of us have been working long and hard in Nashville to try to convince our legislature to adopt Insure Tennessee. Right now, Speaker Harwell has formed a group to come up with an alternative to Insure Tennessee, and we're trying to serve as advocates for that too. It's really important that if we're going to have a healthy community, everyone has to have access to good health care, and right now they simply don't. That has big consequences on the individual. Obviously, it has consequences on our schools. It has consequences on their ability to be employed. It clearly has consequences on the hospitals who find themselves not being reimbursed for the services that they provide. And while we're happy to do it, the truth is we can only run a hospital so long with people who can't pay. As much as anything, though, I think it's a matter of human dignity. People want to be able to pay their bills. People want to be able to be healthy. People want to be able to work. And when we don't provide them access to good health care, too often the consequences are negative for the individual and their whole families. And that ends up being a generational issue. The children of people who are not healthy end up being unhealthy, and it goes through the generations. I've spent a number of years on the board of the Volunteer Ministry Center, and several years ago we were approached by the mayor and asked to change our mission. He asked us to become the housing experts. There was a group up in Boston, I believe, who came up with this idea called Housing First as a way of dealing with the chronically homeless, and the idea was that if you wanted to end homelessness, the best way to do that was to put people in homes and then support them while they were in a new place, as opposed to the traditional model, which was to prepare people for homes but then send them back out on the street as they waited for a home. So this turns that model upside down. As a part of VMC's effort to implement the Housing First model, they took over the old Fifth Avenue motel, and they turned it into 60 wonderful apartments. Now we have a large community of formerly chronically homeless people, each of whom has at least one disability, who are no longer living on the streets. Well, there was an effort among many of us to try to create community within that building. Just because 60 people live together doesn't mean that they have a community, and we think that a large part of being healthy is being in community, having friends, living lives like most of us are fortunate to be able to. So we look for strategies to be able to build community within Minville Manor, which is the facility. And Jenny Weatherstone approached me and asked if I would consider doing a short story ministry there. So on Thursday nights for the last 3 or 4 years, I've been going over and reading short stories with some of the residents. Sometimes we'll have 3 or 4 people, sometimes we'll have 10 or 12 people, it just depends. But over the course of 3 or 4 years, we've developed this small community of friends who has this common bond around the short stories that we read. And frankly, I try to get short stories that will lead to conversations. And some of the conversations about the life experiences that these people have had sometimes are heartbreaking, sometimes are uplifting, but they're always interesting. And I consider the people who are in what we call the Minville Literary Society to be among my close friends. When I have to miss a week, I really miss it. One of the understandings that we have at Tennova is that if we're going to make a difference in the community, we're going to have to do more than just treat people when they're sick. To have a healthy community, you have to have good jobs, you have to have good education, you have to make it possible for people to reach their full potential. And so what we try to do is take a look at our community as a whole and try to look at some of the social determinants of poverty and address those, try to look at gaps in the education system and try to address those. Try to just use our educational expertise to help people live healthier lives physically, emotionally, psychologically. So, happens every time, doesn't it? I've been very fortunate for 15 years to work for an organization that supports outreach to seniors, outreach to children, outreach to people who can't read, outreach to people who are trying to find jobs. And we have 7 hospitals now, some of them in very rural places and some in the middle of the city. And each one of those smaller communities has their own specific needs. And we try to use our resources, not just money, but our expertise and all the other resources we have at our disposal to try to make the community healthier physically, emotionally, psychologically, and spiritually. And I've just been so fortunate to work for an organization that supports that. One of the best parts about working for Tennova Healthcare is that our faith-based roots go all the way back to our founding in 1930 when the Sisters of Mercy opened St. Mary's Hospital on Oak Hill. And all of us here continue to be inspired by the work of the Sisters of Mercy, who still come to the hospital every single day, who go to our outlying hospitals, who continue to do their good work every day and inspire us to be the best we can be. It keeps us grounded in what really matters. It helps us to remember there's a difference between healing and curing, and it helps us to just keep going when times get tough. So I don't know that I would have been, to the degree I've been effective at all, I don't know that I would have been effective without the guidance and support that the Sisters of Mercy provide us every day.